If you ask most dietitians or doctors, they'll tell you that ketones are toxic byproducts of fat metabolism. And that's because most of us trained in clinical medicine learn about ketones in the context of diabetic ketoacidosis. That's ketones up here, numbers of 15 or 20 on a test. My ketones, nutritional ketosis, are here in the 1 to 3 range. Okay, so this is ketoacidosis. This is a flood that sweeps away villages and bridges and highways and stuff. This is a modest, gentle rain that nourishes. Starvation ketosis, that is eating no calories but not being diabetic, is in this range. With starvation ketosis, the kidney's handling of salt changes dramatically. It turns out when you eat carbohydrates and you're carbohydrate fueled, your kidneys retain salt. When you're keto adapted, your kidneys switch and dump salt.
And part of the reason that helps treat blood pressure?
And that appears to be part of the reason that it treats blood pressure. But the other is that the tone of the blood vessels themselves change. And Jeff has done actually some pioneering work in that. Maybe you want to talk about vascular compliance.
We've had an interest in a number of biomarker responses to low carbohydrate diets, including vascular function and blood pressure. And we do see a very consistent lowering of blood pressure. And delving a little deeper into the mechanism, I would agree with Steve that there's this natriuresis effect, and some of the reduction in excess water is contributing to the lower blood pressure. We've actually looked at the functioning of blood vessels using a technique called brachial artery reactivity that measures how the major artery in your arm responds to a hypoxic stimulus. And it's a rather standardized and routine test that's done in studies looking at how well blood vessels function. And anyway, we put people with metabolic syndrome on a very low carbohydrate diet to induce nutritional ketosis for 12 weeks, and we measured how well their vessels responded after that time period, and we showed that they actually improved compared to a more traditional low-fat diet, a group that followed more or less the American Diabetes Association, American Heart Association type diet. We also looked at how these vessels responded after a meal, very high in fat. There's a number of studies that show when you eat a McDonald's meal or a high-fat meal that you see this dysfunction in the way the blood vessels respond. And so many people will teach away from fat because this single meal caused vascular dysfunction. But coming back to the term Steve introduced, keto adaptation, when you allow people more than a couple weeks of consuming this type of diet, you have a very different response to that same high-fat meal. And instead of showing a dysfunction, you actually show an improvement in the way these blood vessels respond to stimuli. So you're improving actually endothelial function. These cells that line the vessels that release nitric oxide are actually functioning at a more beneficial level.
People talk about, there was a study done, actually it's last year, one done in the British Isles with that proved that a low carbohydrate diet was bad for you. But it was a four-day long study.
Right.
If they'd done a 4-week-long study, they almost assuredly would have gotten the opposite result. But A, it's cheaper to do a short-term study, and B, if you want to prove, if you set out to prove that a, quote, Atkins diet is bad, do a 4-day study, and you can probably find things that aren't functioning all that well in those 4 days.